reminding you that we wouldn't accept this, would we? We wouldn't drink dirty water. We wouldn't eat food that had gone off visibly. But yet, we breathe air like this. Now, that air, when you can see it, is full of tiny particles, and it's full of gases. You've heard the name of them. Some of them are nitrogen oxide and ozone. And we know that these are very, very bad for the lungs. And the problem is, I think, that that only happens about 10 times a year, on average, where you can actually see the pollution. And then everybody worries about it, and it's in the front of the Evening Standard, and we think we should do something about this. But then the next day we've got blue skies again, and then we forget about it. So, because most days are like this, should we really be worrying about air pollution in London? And the answer is, unfortunately, yes, because when it's invisible, it's still having an impact on our health. And of course we didn't always know this, but we know it for certain now. We've got really strong evidence. And I'm going to take you through a little bit of that evidence today. So, to explain the health effects, I think it's helpful if we think about what we call the short-term health effects and the long-term health effects. Now, the short-term health effects, Tess will be, where's Tess? There you are. Tess will be talking a little bit about the impact of how you breathe on your lungs if you've got an existing condition. If you've got COPD, chronic obstructive pulmonary disease, or if you've got asthma, then it's on these days where you actually will respond to that air pollution. If you're healthy and young, you probably won't. But the people with the established conditions really have a hard time in the days, those 10 days a year when you can really see the pollution. So we're going to start by just looking at a few examples of this, and then we'll go on to what actually is the more serious situation, is the long-term health effects. So, when did we last have a pollution episode in London? Well, you have to actually look back at the evidence, and this is coming from the London Air Quality Network, the LAQN, if you want to put it into the computer to find it. But we had episodes in February, we had March, we had May, we actually had episodes during the summertime. These are particulate episodes, but during July and August and the beginning of September, the summer was so fantastic, we actually had ozone episodes. And this is another type of pollution which you normally get in Italy, where it's really warm, or even over in California. So we have episodes of pollution, different types, nearly right through the year. And we'll start getting them this month probably as well, as soon as it starts getting a little bit colder. Now, when you have a pollution episode, we now can go to the UK ambulance service, and we can say, are you called out more? And whenever you actually look at the number of call-outs, and this is data from 2015, where we had 2 big episodes, there was 1,200 additional hospital consultations, 2,300 additional hospital consultations. So people were feeling that poorly that they actually called 999 for an ambulance. And of those, a lot of, it's not on this slide, but of those, a lot of them were from people who had COPD or asthma. And they really felt that they couldn't breathe and required intensive care. So that's what happens on the short term when you can see the pollution. But on days like today where you can't see the pollution, we're still in London breathing these pollutants at higher concentrations than we think we should be. And this is all comes out of the World Health Organization, where they give you guidelines as to what the concentrations of the pollutants should not exceed. And this is this main pollutant, these tiny particles. They're called PM2.5. Everybody see this here?
No.
Yeah, I can hardly see it. It's 60 micrometers, that's 1,000th of a meter in diameter. PM2.5, you can get 24 of those little particles across the diameter of a hair. And that's why you can't see the pollution. It's invisible. But when we look at the concentration of PM2.5, and it's mostly in our cities across the UK, then it's, well, this is the important number here, it's responsible for 29,000 premature deaths every year. Now that's an important figure, because the only health figure that's bigger than that is to do with what? Not a disease, but something that we do to ourselves. Smoking. 89,000 premature deaths a year because of smoking, 29,000 because of poor air quality. After that, we come down to alcoholism, about 16,000, obesity, 14,000, road accidents, 2,500. So the quality of the air is really, really important from a public health viewpoint, and that's why we've got to improve things in our cities. If you're interested in this topic, then this is a report that came out at the beginning of 2016. It's called Every Breath We Take, and it comes from two of the Royal Colleges here in London. And what they did was they reviewed all the health evidence, and what they were able to find out was that now it's not just people with lung disease, COPD and asthma, it's people with heart disease, it's people with dementia, it's pregnant women and their unborn children, and it's young children growing up when their body is expanding and their lungs are growing. All these things are affected by the quality of the air that they're breathing. So that's why it's across the life course now. So it's not just the very young, it's not just the very old, it's all of us when we live in a city like this and we're breathing pollution which is too high. Now I'm going to give you next four slides are pieces of information. You don't have to go and read the papers, I'm just going to give you the summary. But they all were published in 2018 and they all have a very bad outcome, really. So this first study is to do with unborn children. So what we found was that mothers who were living in the highest quintile, that's the highest fifth of air pollution in the city, and that means they were probably living beside a busy road, their children were born smaller than mothers who were living in the lowest quintile of NO2. So if they were breathing in more pollution, and this is usually traffic pollution, then they had small for gestational age children. And that is an important observation, because children that are born smaller than they should be actually end up having more problems in later life than they should do. So we've got to stop that. The second study is actually in young children. So this is a study we did in East London, in Hackney primarily. And all these spots here are where they go to school, and the red bits are the road network, and you can see that a lot of those schools are beside busy roads. And when we actually then looked at where these children were living and how they got to school, and we plotted that against the annual exposure to this pollutant NO2, and the magic figure here is 40, because anything below 40 we think is sort of okay, anything above 40 is illegal. 87% of these children, and there were over 2,000 of them, were living, their houses were in where the NO2 was illegal outside the front door. And that's an incredible statistic, and it's a sort of one, until you do a study like this, you don't really know the magnitude of the problem. The third study is one where we used our famous Oxford Street. So Oxford Street only has, as you know, red buses and black cabs, all run on diesel. So in fact, pollution in Oxford Street is very high, always. And what we did was we had volunteers, people with COPD and people with ischemic heart disease, and we walked them up and down Oxford Street for 2 hours, and we measured their lung function and we measured their vascular reactivity. And then on another occasion, we asked them to come back and we walked them around the round pond in Hyde Park, and we did exactly the same measurements. And what we found was that if you do exercise, you get a little bit of benefit. So your lungs work a bit better, your blood flows a bit quicker. When they were doing that around in the Hyde Park, around the round pond, we saw all that, all the good things. When they were walking up and down Oxford Street, we didn't see any of those good things at all. because what they were breathing in was stopping their blood vessels and their lungs really working properly. So again, just going out shopping in one of our major streets is a problem. And then the final study, which we have just published, is around dementia. And again, this is like the very first study. We looked at where people lived, and if they were living in the top quintile of NO2 exposure, then they had a 40% increased chance of getting dementia than if they lived in the lowest quintile. And again, this brings us back to the situation where it's people who end up, maybe because of social status, what they can afford, where they can afford to live, getting these higher exposures. So, you know, as a city, what we've got to do is just bring down pollution for everybody's benefit. We're in Westminster. Westminster has got pollution. So these are some of the roads in Westminster. These are NO2 concentrations. And what I can say to you is that your council is very much aware of this, and they're very much trying to do something about this. They've brought in a number of schemes to try and decrease air pollution and improve air quality. But this is Oxford Street, as I said. It's all diesel vehicles. We've got to do something about that. Caroline will be speaking to this issue very shortly. But the pollution, this NO2 and this PM 2.5, it primarily comes from road transport. That's what that's saying over there. And whenever you bring that big part of the road transport sector and you break it down, you can see TfL buses, non-TfL buses and coaches, big lorries, taxis, diesel cars. So diesel is the big problem which we've got to bring under control in our cities. And it's the same for PM 2.5. Interventions are very important because we can use them as illustrative positive measures. I don't know if you remember, but we had a bus strike back in 2015. I think it was Sunday. This is NO2 concentrations. Sunday, Monday, Tuesday, Wednesday, Thursday, bus strike. So if you stop the traffic moving along, you will not see the pollution. This is the remaining bit here was the taxis that were still there.
Where does the pollution go?
It's not being emitted, so it doesn't have to go anywhere. There were no buses, so no pollution was coming out of the buses. That's a different issue, and we can talk about that, and Caroline can talk about that as well. But it's just if you remove the source of the pollution, then very quickly you improve air quality. Regent Street, every December on Sundays, the lower end of Regent Street is shut to traffic for shoppers. This is black carbon measurements. We give the parking wardens these little accelerometers which measure black carbon. Anything that's yellow is good, anything that's red is higher pollution. So where you block the traffic, then you can very quickly get rid of the pollution. Whereas there's the upper part of Regent Street and there's Oxford Street still polluted. So we've got to somehow remove the source of the pollution from where people are moving about. You're going to hear from Caroline about all the things that the mayor's trying to bring in to help the situation. But I would just say my final slide here, my parting comment to you is, you've probably heard quite a lot about electric vehicles as being the solution to all this problem. They're not. And that's because electric vehicles are zero emissions from their tailpipe, but in fact from a vehicle you get emissions from the tyres, you get emissions from the brakes, and you get emissions from the road wear. So even if we replaced every vehicle in London with an electric vehicle, we would still have a particulate pollution problem. So we've got to get better public transport, and we've got to get fewer private cars on the road if we're going to solve this problem. Thank you very much for your attention.